Hi, I'm Lewis. I'm the founder of Restored Eden Physiotherapy, and I am going to explain how to give you some exercises when you've just had a hip replacement. So when you first have a hip replacement, then you'll have the operation on one day, and then the very next day you will get asked to get out of bed and walk with a Zimmer frame. So then you'll be moving the Zimmer frame and then step, step, Zimmer frame, step, step. And the whole idea is to get your muscles strong as quickly as possible, because they have been cut into and now you need to stabilise the new joint with muscle. When you've just had a hip replacement, the muscles are going to be very weak and we're trying to get them as strong as possible. If you've had a hip replacement, then that's going to be because you had arthritis in your hip. So you're going to have limited range of movement. So all of the muscles and soft tissue around that area is going to be restricted. So we need to get your leg moving as quickly as possible. So if you've got a bag on your foot, to make the friction less, then you can do hip flexion like this, and then also hip abduction. So you want to just try and get your leg moving as much as possible, and you can do the other leg even though you haven't worked, even though the other leg hasn't had an operation, it's still good to get the other leg moving as well. And then you can do static quad exercises. So static quad exercises are where you push your knee into the bed, so you're squashing your knee into the bed and then you're contracting the muscles. So that's relaxed and then that's tense. You should see your muscles poking out as you contract the muscles. And then the fourth exercise is a straight leg raise. So you do a static quad exercise. So you squash your knee into the bed, bring your foot up to the ceiling and then lift. So you're pushing your knee into the bed, drawing your feet towards you and then lift like this. So that's a straight leg raise. If you can do a straight leg raise, then that's also going to help you to be able to walk, because you're able to lift your leg forwards when you're walking. So those are the exercises that you need to first do. When you've progressed from sitting in the bed, then you can do some standing strengthening exercises. So they are, if you're holding onto a wall, you can hold onto a kitchen sink or a chair or something like that, and then you can do taking your leg out to the side. So you want your leg completely straight and your back completely straight, so that you're purely working your hip abductors, so the muscles that take your leg away from the midline. And then you can do some hip flexion like this. And then you can also do some hip extension. So you're keeping your back nice and straight, so you're only working your glutes. When you're good at doing that, then you can do some exercises on the bed. So we want to be able to work our muscles on the side of our hips, so we can do clams. So we can do this on both sides. So taking your knee up to the ceiling. And then also hip abduction. So having the ability to lift your leg against gravity is really important.
When people need a hip replacement,
Often do this because their leg is hurting. So they're hip hitching. So they're lifting, if this was the arthritic hip, then they don't want to put any weight on it because it's hurting. So they're doing that. So they're not really extending their hip. Whereas if you're walking normally, then you do that, you take your leg into extension. So now that we've had the hip replacement, we need to make sure that we're getting hip extension. So it's important that the exercises are reflecting that. So another exercise is where you're lying on your front and then you're lifting your leg like this, because that, if you're lying on the floor, you can't cheat. You have to take your leg into extension. And then if you're doing that against gravity lying down, then you'll be able to do it when you're walking. Another thing that people need to be worried about is having a dislocated hip. Quite often, women are much more likely to dislocate their hip, and that's because they keep their knees together. So for example, if I was going to empty the dishwasher or empty a washing machine, then I might keep my knees together and then do that. But that means that my hips are really vulnerable to popping out because my knees are together. Whereas if you think about the ball and socket joint, if the femur, so this is the femur, and then the head of femur is inside the acetabulum, if you're ramming the femur into the acetabulum, then it's not going to dislocate. So if I stick my feet out and my legs are wider than my hips, then when I squat down like this, you can see that my legs are going right into my hip socket. So it would be really difficult to dislocate my hip in this position because I'm pushing the femur inside the acetabulum. So if I bend down to empty the dishwasher or the washing machine like this, then it's a much safer way to do it. And the same if you're getting in and out of the car, sitting with your hips higher than your knees, then that's a good idea. Because if your hip is like right up here, then it can pop out. But then again, if you do want to get your knee right up there because of whatever reason, and maybe it's like quite a long time after your hip replacement, then if you think about having your legs apart again, so you might be able to get your knee higher, but if your leg is like this and your legs are apart, then again you're ramming your femur into your acetabulum and you're unlikely to dislocate your hip. So you just have to think about how you're doing things and what exactly are the biomechanics of what you're doing, and then you can work out whether you're going to dislocate your hip or not. So if I was to get out of the car, if I had a cushion on my seat, then my hips are higher than my knees, so I'm unlikely to be putting that much stress on the hip joint. And then if I take my legs apart and then go like that to get out of the car, then it's again less likely that I'm going to dislocate my hip. So you have to think about the biomechanics and get your muscles working as strong as possible, because once your muscles are really strong around the hip joint, then they are encapsulating the hip, and then you're no longer likely to dislocate your hip. The people that dislocate the hip are the people that don't have the stability and the muscles are weak. So when you've had your hip replacement, then your full-time job is to get your muscles working as much as you can, and then really encapsulate the hip joint with muscles, and then it will feel stable, and you will even know that you feel a lot more confident and you don't feel like it's going to dislocate. Thank you so much for listening. Please subscribe to my channel with the link below for more Pilates videos. Thank you, bye bye.